So today we will be presenting a case about Fabio June Hele by doctors Lexi Forrest and Bryce Hendershot. Fabio is 31 years old. His date of birth is December 8th, 1985. He is a male. He is 185 pounds, standing at 6'3", and he is currently married with 2 children. So Fabio has a pretty clean medical history, other than the fact that he had his tonsils and adenoids removed in 1990, and he's recently sought medical help for mental problems after his brother died of a freak accident. His family health history isn't as clean as his own personal health history. His mother died of skin cancer, particularly melanoma, and his father also died of skin cancer, in particular basal cell carcinoma, and his sister died of a freak heart attack a couple years ago at age 40. There's still no known cause of that. And then his maternal grandmother died of brain cancer, and his paternal grandfather died of multiple sclerosis. Fabio went to see his family practitioner on April 18, 2016, and he reported to her that he had pain in the back of his eyes as well as his lower back. He also had many tremors of his hands and feet, and at times he felt loss of control of his whole body. He reported cramping easily during running and biking. He had difficulty walking as well as a loss of balance at times. And during exercise, he was easily fatigued and became dizzy. And he also reported frequent urination, not only at night, but also during the day. He reported pins and needles, as well as tingling and burning sensations in his extremities, as well as blurred vision and slurred speech at times. So after having these symptoms for about 6 weeks, Fabio went to see his family practitioner, Dr. Alexis Forrest, on April 18, 2016. All they did was they updated his medical history. They got his family history of the serious diseases that they've all had, and they were concerned about the slow reactions, muscular and neurological deficits that are not common, and his tremors. And after all that, the doctor recommended that Fabio go and visit neurologist Dr. Derek Shepard for further testing to develop a diagnosis. Fabio was referred to neurologist Dr. Derek Shepard by his family practitioner, Dr. Forrest, and the patient is experiencing a wide range of symptoms, including pain in eyes and back, tremors, tingling and burning in extremities, and muscle fatigue, which are the most serious. And extensive testing is needed to diagnose the symptoms of Mr. Hele. And preliminary diagnosis is a neurological and muscular disorder, possibly multiple sclerosis. And the recommendations by Dr. Shepard are as followed: a blood test, a lumbar puncture, an evoked potential test, and an MRI. Dr. Lexi Forrest ordered a blood test to test for any abnormalities in white blood cell counts and things along those lines, but they came back with no abnormalities, and since that came back negative, they could rule out the possibility of a brain tumor, which they thought was a very likely possibility of what was causing his symptoms, and she recommended a lumbar puncture to test cerebrospinal fluid. The neurologist next ordered a lumbar puncture, also known as a spinal tap, to test the cerebral spinal fluid to look for oligoconal bands. And when these bands are found, it shows a production of antibodies that can lead the doctor to thinking that this person has something in their system that the body is trying to fight off. And yes, Fabio did test positive for these, so there's definitely a problem with the immune system, and the next recommendation is evoked potential test. So here's a picture of the results of the evoked potential test. As you can see, the dotted line represents normal ranges, and below the line is where Fabio tested a lot, showing that he has slowed responses to all the electrical stimulation that was sent to his brain. So there's definitely a blockage or an interference in the motor system of his brain. So, what this evoked potential test shows us is that there is a slowed response to electrical stimulation, and with this slowed response, it shows damage to the central nervous system, and we can infer that there are lesions on the brain. But the only way to prove that there are actually lesions on the brain is to do an MRI, so that is the next step in diagnosing Fabio. So now here are some images of the results of the MRI, and the areas to focus on while looking at these are all the white areas because those are going to show lesions on the brain, and white matter, which is plaque buildup inside the brain. So here's a really good picture of all the white matter that is on Fabio's brain. A lot of it, most of it is white matter, which is area for concern. Although this image is kind of blurry, you can still see white dots representing lesions on his brain. Although you can't see any lesions on this image of Fabio's brain, that is a good thing for us doctors because it shows us that the lesions are only in the motor cortex of his brain, which helps us in diagnosing him with some sort of muscular disorder that involves neurological communication with his muscles. So, the results of the MRI show multiple hypertensive lesions in the corpus callosum and high signal intensity lesions, as well as numerous white matter plaques in causal and paracausal white matter distribution. And what this tells us is there are multiple lesions on the brain, as well as a lot of white matter areas, which have helped us conclude our results in this case. And further recommendations are we have prescribed him the following 3 medications to take, as well as we have recommended him to see an occupational therapist who specializes in his disease, as well as seek help from the same psychologist to help him deal with the mental side effects of his diagnosis.
After extensive testing, the diagnosis is that Mr. Helle has multiple sclerosis. This disease causes the buildup of plaque in the brain and leads to damage in the myelin coating of the central nervous system. It does not affect patient's life expectancy, but is an incurable disease and lives with the patient indefinitely. 30 out of every 100,000 people in the world develop MS, and it is more prevalent in young women of European descent. It was first documented in the early 19th century, and the first experiment was conducted by Jean-Martin Charcot on a patient who had recently died, and he dissected her brain to discover that she had multiple sclerosis. Our patient on the left, Fabio Henley, was determined to have multiple sclerosis. It was determined by 4 testings. The first, evoked potential test, showed that he had slow responses to electrical stimuli given to him. The second was a blood test, which showed no abnormalities in the blood. A lumbar puncture test showed elevated white blood cell levels and IgG bands were present. The MRI scan showed white masses in the brain, which caused nerve damage, and he had damage to the myelin coating on his nerve fibers. The first prescription given by Dr. Shepard to Mr. Helle is Gilenya. He is prescribed to take 1 200 milligram tablet daily in the morning and is used to slow the effects of multiple sclerosis and reduce the frequency of relapses. The next prescription by Dr. Shepard is Aubagio. Dr. Shepard prescribed Mr. Helle to take 1 400 milligram tablet daily in the morning with a meal, and then it is used to block the reproduction of defective immune cells, which are speeding up the degradation of his central nervous system by targeting the nerve coating. The final prescription given by Dr. Shepard to Mr. Helle is Tecfidera. It is used to decrease the frequency of relapses and the severity of each relapse, and he is prescribed to take 1 100 milligram tablet daily each evening. Now that we're done determining Mr. Helle has multiple sclerosis, we must move on to living with the difficulties of multiple sclerosis on a daily basis. Dr. Shepard referred Mr. Helle to the psychologist Dr. Sarah Money in order to deal with the daily difficulties. She noticed that Mr. Helle had weight loss, depression, lack of motivation or caring. He was always exhausted no matter the amount of rest or sleep he received, and he became irritable. He also needs a way to vent stress, and the psychologist will provide that. Sarah Money prescribed Nuedexta and Cymbalta to ease everyday living. The first prescription, Nuedexta, prescribed by psychologist Dr. Money, was prescribed for the taking of one 200 milligram tablet every time an emotional swing occurs, and it is increasing emotional stability and decreases Mr. Helly's random outbursts. The final prescription, Cymbalta, is required by Dr. Money for Mr. Helly to decrease his depression, pain, and anxiety attacks by ingesting one 500 milligram tablet once a day after each meal. The last medical professional that Mr. Helly will visit during his treatment is his occupational therapist, Dr. Alyssa Myers. He was referred to her by Dr. Shepard, his neurologist. She has noticed persistent muscle fatigue no matter how much he has rested, and he has also inconsistent symptoms which are disturbing his normal workdays and daily life. She is working with Mr. Helly to decrease his symptoms and to teach him how to manage during episodes to avoid outbursts. She recommends exercise demonstrated in her lessons, including breathing exercises to control pain when it is present to prevent breakdowns, to call her during episodes so that she can walk him through controlling his episodes, and to be able to create a slow progression and learning of controlling his multiple sclerosis. And he is also required to attend sessions about once a week until he shows improvement controlling his pain, his episodes, and increased improvement overall. Our last slide is a list of sources used by our medical professionals and staff in order to determine that Mr. Helly has multiple sclerosis, how to assist him in his daily living, and to prescribe prescriptions to him in order to ease these symptoms. Also, they were used to help ease Mr.